Hello, I am Cindy Kovar, Program Manager for Texas Agribility. We are part of the Texas A&M AgriLife Extension family. Today we're going to discuss the role of occupational therapy in amputations. Rehabilitation after an amputation requires an interdisciplinary team comprised of physicians, occupational therapists, prosthetists, social workers, and psychologists. Having support from family and friends is also helpful. The primary role of occupational therapy in amputation and rehabilitation is to facilitate an individual's return to maximum performance of daily occupation and roles that lead to a meaningful life. OTs can help individuals with amputations by providing training in activities of daily living, dressing, eating, bathing, employing approaches grounded in neuroplasty, the brain's ability to reorganize itself and make new connections, important for amputees in regaining motor skills and adapting ways of performing tasks, assessing fall risk, especially for lower limb amputations, addressing psychological concerns such as depression, anxiety, and body image, conducting a home assessment to ensure the living environment is safe and effective for rehabilitation efforts, which can also include farm and ranch environments. OTs can also provide support for amputees by providing education on prosthetic use and maintenance, educating on adaptive techniques for increased independence, such as transferring, dressing with one hand, and utilizing assisted devices, recommending home and farm ranch modifications for increased accessibility for safety. For example, rails, ramps, grab bars, lifts, extended steps, gate openers, and hand controls. They can assist with coping skills and providing resources such as support groups, amputee coalitions, arm dynamics, and agribility. They can provide pre-prosthetic training, which includes pain management and muscle strengthening strategies. They can teach necessary skills such as how to properly put on and take off a prosthetic, maintain skin hygiene, and safely complete daily activities. Here's a diagram of an arm in the amputations. Upper limb amputations are usually described as above the elbow, AE, or below the elbow, BE. Interscapular, thoracic amputations of the entire upper extremity, scapula, and clavicle above elbow. Transhumeral amputations through the humerus above the elbow. Transradial amputations through the radius and ulna below elbow. Disarticulation amputations through the joint either at the shoulder, elbow, or wrist joint. Lower limb LL amputations are usually described as above the knee, AK, or below the knee, BK. Proximal LL amputations include hemophilia-tomas and hip disarticulations. Both are above knee amputations. Transfemoral results in the loss of the knee and everything below it, AK. Transtibial amputations of everything below the knee but maintain the knee, BK. And Sims amputation results in loss of both ankle and foot functions. Here's some great references for any of you guys that might want to learn more. A special thanks to Sarah Pierce and for doing the research for this model. And also, please contact us for further information about Agribility. Cindy Kovar, Texas A&M AgriLife Extension Services, 979-321-5232, or email me at cmkovar@ag.tamu.edu. Thank you for your time.